So for me in my training, the key thing is not just about kind of trying to reduce self-harm as a behaviour, it's about, well, what's the cause? And that could be individual for each young person. So is it a safeguarding issue? Are they being sexually abused and this is their way of telling us? So it's not just about reducing the self-harm behaviour. And if there's an underlying mental health problem, which there may not be, it's about looking for that. Is there depression, anxiety, treating that? Okay. In terms of risk assessment, you'd want to maintain their safety, prevent suicide, so talk about it, ascertain how big a risk it is, tackling any safeguarding issues if that's relevant, alleviate their distress, form an engagement with them, because engagement is key to reducing risk. So if they feel that sometimes the assessment itself, if they feel that they've confided in someone and that's been helpful and they're going to see you again, that can really massively reduce risk. Making the family involved, getting information from the wider network, and having the family on board and understanding what's happening and helping them to be part of that, so that reduces risk as well. And parents do need to know if the young person is thinking about ending their life, because parents need to be part of keeping that young person safe, so you would be able to kind of work confidentiality with that. Understanding why is the young person presenting in this way at this time, and helping them to, ideally, is really helpful. And then what I try and do in the crisis team I'm working in is that they should have an intervention, not just an assessment to say, like, are you suicidal or not? If not, then you can go home. It's about actually, before you go home, what has changed? What have we done? What have we talked about where an hour ago you were feeling suicidal and now you're not? What's been the difference? So I'm going to briefly talk through the Royal College guidance that was released in October 2014. There was an existing Royal College report that was quite old and out of date, so there was a group set up to kind of just make it up to date and to sort of make a document that was coherent with NICE guidance that, you know, looked at that and not to sort of replace NICE in any way, but and then I was one of the 4 people in writing the document. We consulted widely, so it wasn't just 4 people in the room having an argument, although sometimes it was. But we consulted widely with other organisations like Young Minds, the Royal College of Paediatric and Child Health, with general practitioners, with basically everybody. And then we have other endorsement of the document. That's where it's located, so you can just Google CR192, self-harm, it comes up, but that's the actual location. So it's a document that is not that long, it's quite an easy read, you could flick through it on the train on the way home if you have access. It's up to date in its context and evidence. It focuses more on models, roles and pathways rather than assessment and treatment, and it talks about how services should work together. Summarises a psychiatric perspective. The kind of key gaps that it attends to, my baby in this document was the 16 to 17-year-olds, which I didn't get a chance to talk to Louise about, but hopefully she's here now. She's still here. Louise still here? She's gone. Okay. And community presentation and young person involvement, so those are the kind of gaps.